Nope. Hey guys, thank you so much for joining us today. We are so excited to have Dr. Ferrara back with us, and he's going to give us some information about a very important topic that a lot of you guys probably have a lot of interest in. So I can't wait to hear some of your comments and things like that, and we will go ahead and go from there. So Dr. Ferrara, we want to talk about, what are the symptoms of migraines?
Okay. Symptoms of migraine, basically just that migraine is another specific type of headache.
Okay.
People get headaches, as you know, all the time. It can be from tension, high blood pressure, just different things. They can get headaches, but migraine is a specific type that people get. It's not one-time event.
Okay.
It's usually a lifelong event. That's how you sort of want to diagnose of migraines. Usually begins in people when they're teenagers. I've seen some kids, the headaches begin when they're, 8, 7 years old. Those are rare, but usually when they're teens, it
So around
begins.
7 or 8, sometimes rare?
That is rare. Though.
Okay,
Mostly, I'd
okay.
say around high school age, they get these headaches that occur monthly, or they all have a pattern. They recur every month, every 2 weeks,
Okay.
every 6 months, every year, and there's some, unfortunate, it seems like it's almost every week. It can be debilitating.
Okay.
And that's what basically is migraine, just a recurring pattern. Usually they're unilateral, one-sided. They have a throbbing effect. And usually some people, they have to be in a dark room. Light makes it worse. Noise makes it worse. And for most people, if they just go to sleep, it goes away. Some people need medications.
Okay.
And sometimes some people have to go to the emergency room. One of the things about migraines is that begins what they call an aura, which an aura is basically a Latin word for like a shadow. Begins with something where sometimes they know it. People have migraines, they know it's coming on. It's interesting, they smell a funny smell.
Wow.
Or they have a certain sound, or they have a visual aura where they see lights or they see something, they know it's coming on. And like I said, just one-sided, and sometimes get you nausea, some people vomit from it. And it can be pretty debilitating.
So like basically, if a person has migraines, do you have to be diagnosed with migraines? How does that work? Is it
usually diagnosis of exclusion when you start getting these headaches? After every month, usually most people go to see their physician, and then a neurologist make sure there's nothing else going on.
Okay.
A lot of times they might get a CAT scan to make sure it's not a tumor or something like that. But it's just a way to pattern the way it's described, and it's very common. It's been since like it's beginning of mankind. Now I tell you though, if somebody comes in and sometimes I get an emergency patient's here for migraine, and I go in a room and they say, well, tell me about your headache. Oh, this is the first time I ever had it. Well, it's not a migraine, and that's usually tells me a clue. Hey, something else is going on.
Okay.
Got to take this seriously. Or so that is the biggest things. People don't just develop migraines in their 30s or 40s or 50s. That is unusual. It's usually something that's lifelong and begins in their when they're teenagers.
Wow. And so basically, how would a person know what are some physical symptoms that people feel? What are the physical things? I know you mentioned nausea, but
no, headache. The main thing is the headache on one-sided. Light bothers you, nausea.
So you mean like if you're in a dark room and all of a sudden light comes on, or
yeah, or if you're outside in the light. Like
Okay.
Even this environment right here really bothers them. Loud noise. Sometimes even somebody's voice
Okay.
bothers them. And nausea and vomiting, those are the main symptoms, usually nothing else. Having said that, there's a little trivia question. And for those emergency physicians out there, I can tell you it's going to be a board question. What is the most common cause of TIAs, transient ischemic attacks, just mini strokes? Do you know what's the most common cause?
Of a mini stroke? Maybe stress?
No, it's migraines.
Wow.
So believe it or not, the most common cause in the United States for mini strokes is actually migraines. So most of these happen, the reason you know is that people who have this regular pattern of headaches where they come on every month or every week, whatever it is, at some point in their life they end up getting the worst headache they ever had. But a lot of times they present as a stroke, where they look like a stroke. They can't move their arm, and they can't speak, they can't talk.
Wow.
And after ruling out by CAT scans, MRIs, everything else, then you realize what they call a complex migraine headache. Again, if you treat it as a migraine, it's easy to fix, and usually goes away.
And so how do you fix it? How is a migraine fixed?
Okay, So for most migraines, people already have medications they take prescribed, such as very strong prescription versions of Motrin,
Okay.
Tylenol. That's most people. That does the trick.
Mm-hmm.
A lot of times the prescribed medications are more specific. The most common is Imitrex, but if you give it early, it does relieve it. There's different medications that some people take preventive medicines. If it goes beyond that, the old, which doctors are getting away from now because of the strong and for legitimate reasons, adverse effects of narcotics, they treated with medications which are nausea medications.
Okay.
The most common being Reglan. And it's interesting, it only works IV. If it's given by mouth, it's a nausea medication.
Okay.
Actually an older nausea medication now, given the newer medications that we have, like Zofran, which is the most common. It's rarely used. Phenergan or Compazine is another drug. And it's a medication that given IV, it tends to relieve it. What happens if people come in if they come to the emergency room, I had one over the weekend, with a headache, it's 10 out of 10. They say it's the worst headache I ever had. And you give this medication with Benadryl to prevent a side effect of it. And within 30 minutes, the headache goes to about a 10 to a 5 or a 4, even a 6. But it's enough to all of a sudden, it's almost, they say, like just huge pressure's almost been relieved. It's almost like somebody pushed a hole in the balloon and deflated it. But they're also very sleepy. And usually I tell patients, if you go home, I promise you're gonna sleep because you're drowsy from the medications I gave them. By the time they wake up, it's gone. There's no rebound effect. And it works for me every time. I've used this now for close to 30 years.
We have a question from Germany. Milko says, hi there. He says, who are more affected by migraines? Is it women or men?
I believe it's women. In my opinion, it happens to be women.
Good question, Milko. Thank you.
Very, very good question. Guten Tag, or Guten Abend. Anyway, so it's interesting, there's also a trivia how this medication was discovered. And this is before internet or people. Right now, we find something, doctors can communicate almost instantaneously, either at a forum, to Facebook or social media. We can communicate our findings. But back when I started as a resident, there was a drug called DHE that used to be given for migraines. It came to the emergency room. But because they had nausea, by the time they went in the cabinet and got this medication, the nurse would give Reglan for nausea. By the time they gave this drug DHE, the patient says, oh, I'm better. And somehow through, let's say I'd be talking to my friend Marco Coppola here in Buffalo, my other friend in Buffalo, my other friend in Texas. He say, hey, this happened. Did you happen to you? So somehow then we got to conferences annual, we started saying, wow, this is an actual phenomenon. You know, there's got to be something about Reglan. And they've looked for years. They still don't know what is it about Reglan that causes this. Nobody knows. But so what? Let's just give it IV. They try to give an IM, which is between the muscle by a shot. It doesn't work. Try giving by pills, doesn't work. But something about it, when you give it IV and you give it slow over 2 minutes, and 20 minutes later the patients are better. So I think
20 minutes?
20 minutes. And the thing about it, some people like come in and say, oh, I only want the medication begins with the letter D. You know, I don't remember. Demerol, Dilaudid, narcotics. And to me, as I explain to my patient, it's like, I can treat your pain, but I'm not treating the headache. Meaning, I look at him and say, look, I can break your arm and give you all the pain medication in the world. I still haven't fixed the arm. So that's how I convince him. Let's do this. I say, trust me. And to me, if it's a true migraine, then this works.
Well, if you guys have questions, Milko said Guten Abend.
That means good evening.
Good evening. So if you guys have questions about today's topic, please feel free to put your questions up there, because this is a good topic here, and we wanted to answer some of your questions that you had out there.
And migraines is very common. I'm surprised we're not getting more questions. Migraines is very common. Rossi wants to know, would like to know what we're talking about. Rosanna, stiamo parlando dei i mali di testa che sono dei migrani. Che sono molto comuni, infatti non so se tu ce l'hai, ma stiamo parlando di mal di testa. Grazie per la domanda. Okay.
So if you guys are just now tuning in right now, we're talking about migraine headaches, and I think this is, I think you answered a very good question. Who is affected more by migraines, men or women?
For sure,
and
women.
Why women?
That I do not know, but there's a lot of triggers that trigger migraines. Some people it's chocolate, some people it's something else. For women, actually, is the monthly cycle tends to trigger it.
Okay.
In some women. I see it more in women in general. However, when it comes to younger population like children and preteens, it's actually men. I see more in male children.
Okay.
That's just an observation that I have.
Wow.
Yeah.
So if you guys are watching right now, this is a good time for you to ask your questions about migraine headaches, because this is a common thing that happens, and we want you to get actively involved in today's topic. So please feel free to put your comments up there. Ask about migraines. We talked a little bit about some things you can do to help reduce the pain. And is that reducing or just basically, can you ever get rid of migraines, or is it like something that stays
nobody
with you
has,
forever?
but some people can reduce the frequency by using medications, which can reduce it. But a lot of times also reducing the stressors. And a lot of times.
And what do you mean by that?
It goes along with everything we've been talking about. You know, exercising, staying stress-free, you know, mental clear. I always recommend yoga, meditation.
What about the foods you eat?
The food you eat, many times is triggered by the food. And some people, I figured out that it is the food. For example, I gave you the example of chocolates can trigger it. Some people is alcohol. Everybody figures out what their trigger is.
Okay.
It is, and many times it is food. I totally agree with that. And I think rather than just going and saying, oh, let me just take the pills, I think if you figure out the triggers, and also reducing many times is just stress at home, stress at work, stress, you know, everyday stress. So
exercise helps a lot with migraines,
I think it does, yep. Most
Okay.
people that exercise, it does help a lot.
Like 30 minutes a day or something like that, or just basic?
Or whatever they exercise,
Okay.
like yoga, meditation,
Okay.
eating right, it definitely helps.
Okay. Well, if you guys are watching, thank you so much, Ben, for watching, Ann for watching, Alice for watching, Melissa for watching. We appreciate you guys watching us right now. We really
If you have any
appreciate it.
questions, let us know.
Absolutely.
I'm more than happy to answer the questions.
And this
really
is what
am.
we're here for. So if you guys have questions, just let us know right here. Just put them in the chat, and we'll definitely answer questions that you do have about migraine headaches, because this is a very common thing that a lot of people deal with on a daily basis. And so some people had an inbox before we did this, and somebody asked, you know, why do men get migraines when a female asks for money? So
I don't know.
I won't say who asked me that question, but
No,
we did.
they had to go, I got a migraine, you know, or they got a migraine when the police pulls them over or something.
Right, right.
But it's nice, actually it's nice out here being in this, what we call an outdoor studio.
Yeah, it's actually really nice out here.
It's really
So
nice
If you
out
guys,
here.
if you guys are watching, you know, please feel free to put your comments up there. We're talking about migraine headaches and
Also, actually, I just thought about it. I was thinking about it. It'd be nice to have a glass of white wine out here now. Just
Right,
got off work.
right, so-
But I thought about wine. Actually, red wine, there's some of the, especially the additives in some of the preservatives in red wine will trigger migraines and headaches.
Wow.
Yeah.
So
white wine, that's why I think some people didn't know what the migraine, they know they will drink white wine because red wines will give them migraines.
So we've always heard that red wine was, you know, good for you.
It is good, but it does trigger some things.
Wow, I didn't know that.
Yeah.
So red wine is
And some
something-
people will trigger
and some
migraines.
people, right? Wow.
Yeah, but not white wine.
Wow. I wonder why is that?
Although it's interesting that white wine, some of the, you know, as you know, white wines come from red grapes. They just take the peels off.
Right.
Like
And you would
Pinot
know
Noir.
because you're from Italy.
Well, no, but wine, family of wine growers.
Yeah. So, all right, guys, we want to know, what are your questions about migraine headaches? And some people, like I said, so would you say that stress is one of the biggest triggers of it, or
I think stress is a big trigger.
stress and non-exercise?
I think just stress in general triggers,
Okay.
but food, hormonal changes, sometimes medications. The reason I know hormones because women who a lot of times start on birth control pills, which is hormones, because it increases their headaches, brings them on frequent headaches.
We got a couple questions here. Milko says, how would you describe the difference between migraine and a regular headache? And Ann says, how do we know if it's a blood clot or a migraine?
Those are good questions. Milko, what I described before, migraine is not a one-time headache. It is one that is where there's a pattern. It's usually unilateral, and the patient coming in says that this is my typical migraine. It's a one-sided. It is throbbing. It is the typical migraine. And usually, if a patient comes in first time with a headache, I'm going to work him up to do everything necessary to make sure that this is not more than that. But people who have migraines usually will tell you it's one-sided, like I said, retroorbital, which means behind the eyes, throbbing, and associated with nausea and lights. Now, as far as both questions, actually exactly the same. Mr. Murat and Ann's questions. How do you know it's not a blood clot? A regular headache. I'm not sure what you mean. The regular headache. There's different kinds of headache where sometimes after people say after working on a computer, I get this headache in the front. Take a Tylenol, goes away. I guess that would be a regular headache. As far as a blood clot, you don't know until you find out whether blood clot causes a headache. Usually, actually, blood clots and do not cause headaches. I know if you mean maybe a bleed in the head. A blood clot is what causes a stroke, and usually that causes no pain. A blood clot that goes to the brain is considered a stroke. So I'm assuming, and you mean a bleed in the head, and usually those are the differences also where the migraines are gradual, coming over time. The blood clots is all of a sudden they will say, or now you got me saying it, bleed in the head or something else. It's sudden headache. They usually describe as a thunder. All of a sudden something hits you all of a sudden, just exactly that sound, like that clap, that quickly. Where migraine is more gradual, and usually I found people coming in with migraines come in and they said, "Oh, it's my migraine," and they walked away with a different diagnosis, which is usually not that good. And the biggest clue was this was different. Usually on my right side, or this is left, or is this diffuse, or this came out all of a sudden. You use for that what's different about it this time, and if it's different, then you look for other things. So that's the difference. Milko, I'm not sure if that answers your question.
Answer. Thank you for that.
You're welcome.
As well. Yeah, and so this is what we're just talking about here today, guys. So if you're just now tuning in, please feel free to put your comments up there. We're talking about migraine headaches. So I'm sure you have a lot of questions about it.
And this is very common. I mean, most people are going to watch this later. I'm sure they're going to have a lot of questions. I can't give you exactly how many people have it, but it is very, very common.
Wow.
In fact, when I left my work today, the last patient I saw walked in that came in for migraine. There isn't a day doesn't go by somebody doesn't come in for that. In the emergency room, for sure, there isn't a shift that doesn't happen where you don't get that. And that's the beauty about the training that emergency physicians get. They're able to discern, okay, this is a migraine, and stop. We got to worry about this. Something else is going on. Let's make sure.
Absolutely.
Okay.
And thank you. Milko said thank you as well. And Leslie has a question. She said, are pressure headaches from barometric pressure, migraines, or sometimes the severity is so bad that nausea and vomiting is caused by nausea and vomiting?
Yep. Leslie, that's a good question. Actually, barometric pressure does affect the headache and how you feel, and that's been well studied. I wouldn't necessarily call it a migraine headache. I would call it more of a sinus headache, because the barometric pressure affects the sinuses, which is air pockets in front of the skull. I guess part of it is just to make the give us our facial features, but also to make the skull, whoever designed this, higher power, whatever you want to believe in, so that it's part of the brain, makes it lighter. Anyway, we have these air cavities, and the barometric pressure actually affects that. So some people are affected by it, even as a few millimeters of barometric pressure. And actually, I don't know if you can go to our website. If we have old YouTube videos, I did one, I don't remember, I think it was Fox 5 or CBS News topic on this about a few years ago.
Absolutely. So this is what we are discussing here for you guys who are just now tuning in. We're talking about migraine headaches and the effects on the body as well. And we talked a little bit about exercise. We talked a little bit about the wine, how red wine may affect some people.
Well, the people that know, they know.
Okay, I see.
They will know, and they'll say no red wine for me.
Okay.
Or they'll look at the preservatives, but overall they'll avoid red wines. And actually, it's interesting. Red wine, there is a class of drugs. It's just getting off topic here. There is a class of drugs called MAOA inhibitors, which rarely used, but believe it or not, some red wines will trigger almost this toxic effects. Will send them to the hospital.
Wow.
And they're told, you're on this medication, do not drink red wine.
Wow.
Yeah.
That's
insane. So anyway.
Milko says, yeah, one more question. Are there possibilities to prevent migraine?
Yes. So Mirko, if somebody knows the trigger, what that trigger is, then obviously preventing that trigger, it can prevent the migraine. There are medications that people are on that are preventative, and the most common one used in this country is propranolol. There's very low dose once a day, which is beta blockers, and seems to do a good job. But I'll refer that to a neurologist in the audience. But usually propranolol are the ones that prevent those.
Good question, Milko. Very good question. If you guys have questions, please ask us. Ann said, I had a sinus headache for 4 months. Are they dangerous, sinus headaches?
No. The usual sinus headache can be dangerous if it's true sinus infection. If the headache is being caused, nephronal maxillary sinuses right here and right here, from an infection which could penetrate into the brain. Hence we call that meningitis. However, most sinus headaches, especially this time of year, especially in an area where we live, called Georgia, which is a lot of pollen now, and people are getting a lot of sinus congestion, etc. And usually when you got a headache like this, you have to start thinking about allergies. What is it about your house? Usually it's allergies that are causing this. No, they're not dangerous.
I see. So guys, please feel free to put your comments up here. We're not going to be here long. We just wanted to come on for a few minutes and to give you some information about today's topic. So please get your questions up there while we're live, and we can answer these questions absolutely live.
And now that we got the spring break out of the way and Easter, so we'll be doing this more on a regular basis, like we were weekly. So
Absolutely. So this is what we're discussing here today. We're talking about migraines and the effects on the body today. You have any other things to say about migraines at this point?
No, they're just very common, and the people who have them, I said it is a true medical condition because it can be debilitating. And some people just cannot work out of work all the time, or they call in sick, and it just makes it hard. And sometimes it's even hard for them to maintain a relationship. And those are extreme cases. But
so is it pain typically throughout the day with migraines, or does it come and go?
No, it actually lasts for days, and some people actually last 2 or 3 days. Some people last a couple hours. Some last the whole day. Like I said, they go to sleep and it goes away. But in some people, literally, they last for about 3 to 4 days. Now, when they start lasting about 5, 6 days, something else is going on. I think the patient I had last week in the ER, they'd been having the headache for 3 days. They tried the usual home meds, and they came in. And I told them just bite the regular, and I said, you got to trust me on this. And she was so happy when she left that this worked.
Wow. Milko says, good and interesting, guys. Thank you very much. So thank you for watching from Germany. Milko, we appreciate that. And so if you guys are watching this, please feel free to share this on your Facebook page as well, because this is a lot of good information. So please feel free to share this on your Facebook page, because a lot of people do watch these videos later on. Ann says, should we take a baby aspirin every day after 50 to prevent a stroke?
That's never been shown. You can do that, but I think you're going to have more problems than a stroke. If you start taking a baby aspirin every day, you're going to have, I think, more issues with gastric bleeding. No studies have been shown to do that. I think, yes, for people who have high risk for strokes, baby aspirin, or I had a patient today who's actually on a stronger aspirin called Plavix for that, but they had risk factors. I would say no, because when people... I probably don't remember, about 30 years ago, they started putting everybody on aspirin. They said, oh, an aspirin a day prevents heart attacks and stuff. Everybody over 60. Well, we ended up having a lot of people came in with bleeding ulcers.
Wow.
So, yeah, you don't hear about it anymore because that was put to a stop right away.
Okay, wow.
That was a big deal.
Wow, that was a good question, and we appreciate that. That was a really good question, but that was very good information. If you guys are watching this, like I said, please share this, because Dr. Ferrara is giving out a lot of great information, and we'd love to get you guys to share this, because a lot of people do want to hear what we're talking about here today.
Yeah, Milko had very good questions today. So, Fila Danka, Milko.
All right.
B. Gates.
All right. Well, we're speaking different languages on your show today.
I think we spoke 3. We can go to Neapolitan if you want to. We'll make that 4.
All right. This is fun today, guys. So thank you so much for watching. And we'll be back on next week with another topic. So let us know if you guys have any ideas on some topics or something that you want to hear as well.
Something you want to hear, I think it'd be fun for us.
Yeah, because we try to hit on topics that really that you go through every day. And so please feel free to let us know what topics that you want to hear about, because again,
especially with allergy season coming up.
Absolutely.
Especially in Atlanta.
And you can see all this pollen around. I've got pollen all over my computer and my
So don't
iPads.
wash your car.
Yes, it's terrible out here right now. So please feel free to put your...
You know, my biggest, and I coined this, if you live in Atlanta and if you move here and if you don't have allergies, trust me, within 5 to 7 years, you will.
Absolutely.
Slowly.
And you could read that in German from Milko.
It's gutes Deutsche. Danke schön. Ich spreche Italienisch.
And Ann says if you had open heart surgery, the cardiologist recommends aspirin, but that's a special case, I guess.
That is a special case.
Okay. Well, guys, thank you so much for tuning in. We are so excited that you had a chance to watch this exciting show. So please share this on your Facebook page. Let other people know about this great information. And like I said, we try to do this once a week to educate you out there on these particular topics. So please feel free to share it. And so thank you so much for watching. We'll be back on next week. Thank you, guys.
All right. Shoes.
Bye-bye.